let's talk about some of the modalities you can use for some of the foot pain or plantar fasciitis that we've been talking about. So most commonly, there's ice packs and heat packs that people use. Ice packs, mostly with the body, we're using a nice soft ice pack. We can put that on for 10 to 15 minutes, then we take it off, reapply after the hour. It's mostly beneficial for the body. The foot's a little bit different, right? We want to use this hard ice pack, okay? Sometimes it's a blue one. We want to put it underneath the foot, and we want to use a sock, all right? So we're putting a sock, and we're putting it directly on that foot where that sore spot is. It fits on the foot pretty nicely, right underneath, for about 5 minutes on. Take it off for 5 minutes, reapply, and you can increase that application to 10 minutes depending on tolerance of the patient. All right, and you do that for about an hour, and then you can go back to it after a little bit of rest. All right, sometimes people use Dixie cups, right? They'll freeze the Dixie cup with water, and then they use it as ice. They rip it off, and they put it underneath the foot. Sometimes they'll roll it underneath the foot, right, underneath, or they just put it directly on that spot that might be sore. All right, back to the timeout chair. We have the heat pack. So sometimes people will wrap a heat pack under that, put it underneath the foot. It's good for circulation and bringing obviously new nutrients and stuff like that to the foot. It also warms it up, so it feels better that way, better than ice. But I like ice because it decreases inflammation and it numbs it up a bit. So if you're having pain, it might be a little bit easier to kind of walk on, or just to tolerate pain if you're trying to go to sleep. All right. One of the things people do is a lot of foam rolling or rolling to begin with. I like to use a lacrosse ball if I'm going to use that. Now, remember what the foam rolling is actually doing, right? It's compressing the muscle, so that will help relax it, and it helps move fluid around. It's not breaking down scar tissue or adhesion, so don't think that you're actually doing more than you are. It's temporary relief. We really want to get into the clinic and do the modalities in the clinic. So for really tough cases that are, hardened scar tissue or adhesion in there, I want to really break up things quickly, I use the shockwave, which is really good because it's like using silly putty. When you break it apart really quickly, it actually breaks. If you slowly stretch it, it will soften. So using something like ART sometimes only softens the adhesion. It doesn't actually break it down. We also use the metal instruments, which are like Graston instruments, under the bottom of the foot, because it works really well by finding out which parts are being gritty and need to break down those types of adhesions underneath the foot. So those are the type of modalities we use. All right, so remember, improve yourself with home health.